Keeping, there we go. Now that we're recording, let me start again. Good afternoon and welcome to our first Keeping It Brief. We're thrilled to have Sara Jann from the Maternity Care Coalition with us today. And we're going to be talking about thriving PA and the way that we can all work together to facilitate some much needed change. You're watching this recording from the Bucks County Women's Advocacy Coalition website. Thank you for taking time to visit our site and click play. I'm just thrilled to welcome everyone here. This has been our first Keeping It Brief, and what we're hoping to do is a nice midday exploration of a topic that's important to us and some policy issues that we can have an impact upon. We'll do this every month, the first week of the month. So it's part of our efforts at the Bucks County Women's Coalition to advance causes that are important to, that are rooted in our shared principles with a growing understanding of the complex intersectionality of issues. And we want to educate and advocate for issues that create systemic change and create gender equity and advance economic security for all people. So I want to just begin with a quick note about our technology. You are able to, of course, shut your camera off so that you can enjoy your lunch or just kick back and listen and pay good attention and participate in our discussion. Please use the chat function if you have a question, because we would love to share, to respond to those questions after Sara has an opportunity to present what she's doing, what Thriving PA is doing, and how that all works together. A little bit about the Bucks County Women's Advocacy Coalition. We're a nonpartisan coalition of individuals and organizations. That's 300 individuals plus and more than 50 organizations as partners. We started as a nonprofit in we're organized in 2008 and became a nonprofit in 2015. And we're very excited to share a lot of educational opportunities such as this. And we'll ask that you please share it when the video becomes available as well. A few notes before we get started. This is being recorded. Give us a few days and we'll get a copy to you. And you can access it also through a link on our website. Our next newsletter is going to be published on October 14th. That will also include a link to our recording. Please take a few minutes to visit our website at bcwac.org. For more information about the organization, you can read blog posts, you can subscribe to blog posts, you can subscribe to our newsletter, you can connect with our social media, all good ways to get lots of information about not only what the coalition is doing, but what our partners are doing and actions that can be taken to contact elected officials about pending legislation, all ways that you can have an easy way to make an impact. Today's program, like others, is offered for free. While this organization operates with great efficiency, we do have some costs. And if you feel like this program and the work of the coalition is of value to you, we ask you to please consider making a financial contribution. You can do this through our website at bcwac.org or by mailing a check to the Bucks County Women's Advocacy Coalition. Post Office Box 248 in Doylestown 18901. So with that to the side, I'd like to introduce our guest for today. Sara Jann joined our organizational partner, the Maternity Care Coalition in March of 2016 and currently serves as Director of Policy and Advocacy. She advocates for policies and legislation that promote equitable maternal health care outcomes and early learning services. Before joining MCC, Sara earned her master's degree in political science and international relations at the University of Delaware, where her research focused on gender, citizenship, and economic development in the global South. While at the University of Delaware, she worked as a research assistant, and her findings contributed to an award-winning book, No Shortcut to Change, An Unlikely Path to More Gender Equitable World by Dr. Kara Ellerby. You can see why she fits so well with the principles of the Bucks County Women's Advocacy Coalition. She also has a background in public benefits access and is passionate about the intersection of maternal and child health and economic security. She lives in Mount Airy with her husband, Nick, and her 2 children, Casper and Eve. Today, she's going to brief us on Thriving PA, which is a nonpartisan statewide campaign that seeks to improve the quality and increase equitable access to a coordinated system of health supports. And she'll talk a little bit more about that and the role of MCC. Welcome, Sara.
Thank you so much, Maria. And thank you, Iffy, for inviting me. I am really excited and proud to be participating in the first ever Keeping It Brief. It's such an important issue that I'm excited to talk about today. But as Maria said, I just want to set the stage a little bit for folks who may not be familiar with the organization that I work for, Maternity Care Coalition. Our organization was founded in 1980, actually as an advocacy organization. And so over the past 40 years, we have grown, and now our work is in-home, community-based virtual supports for families with children ages 0 to 3, research, and then policy and advocacy. All of this work put together is about ensuring that parents in Southeastern PA impacted by racial and social inequities can birth with dignity, parent with autonomy, and raise babies that are healthy, growing, and thriving. So it's a natural transition into the Thriving PA campaign. Thriving PA is an extraordinary and new campaign, and our work covers a few different maternal child health sectors. The work I'm excited to talk about today is perinatal health, but I have partners across the state that are also working on children's health insurance access, nutrition, WIC benefits access, and also lead poisoning screening and abatement. And so it's an extraordinary campaign, and it's really rooted in the understanding that maternal child health really is the foundation in many ways to kids growing up healthy, to families being strong and healthy. And if we want to see long-term positive change, we have to start right at the beginning.
Good. So what? Oh, I'm sorry. I heard an echo. I did. I'm echoing.
You know what it is? It's recess across the street.
So there you go. That's the timing.
Yep.
So what does Thriving PA enable you to do as a coalition member? How does that, as we do at the Bucks County community, at the Bucks County Women's Advocacy Coalition, we try to amplify the voices of our members so that they become more powerful. I'm assuming that's the kind of thing that Thriving PA offers the MCC?
Yeah, it's very similar. And so primarily members of the advocacy campaign are organizations, but that's really like a very broad category. So for example, if I were to talk about my partners on the perinatal health advocacy campaign, we have the PA Partnership for Children. We have the PA Health Access Network. We have the American Academy of Pediatrics, the March of Dimes. We have healthcare systems, members, representatives from managed care organizations. It's really important that we pull from multiple sectors in order to be able to be effective in our work. And so for me, leading this part of the campaign, I'm like, everybody come on in. If you care about perinatal health, if you're passionate about perinatal health, if you know that it is absolutely time for some policy change around perinatal health, we would love to have you and your organization as a member of our campaign.
Sara, are there other states that are doing this well? Are there best practices that you're learning from this as far as perinatal
That's a really great question. There are incredible advocates all over the country that are doing very similar work. I would say that our campaign it's a good one. Not just because I'm a member of it. I would say that our campaign is really well organized, and that we have, we're a newer campaign certainly, but that, we're already out here talking to you all today about our campaign. But there are incredible advocates across the country. Illinois and Texas come to mind, folks working on this, working across sector. And a lot of this work has been made possible by the Pritzker's Children's Initiative that has really facilitated this prenatal to 3 advocacy because it's just so important.
And how did that come about? Like, why is there now this focus and this will to look at that area of health?
Such a great question. So, I think historically, the way that we look at both maternal health and children and child health, it's almost as if, speaking for children, it's almost as if like folks think they don't exist under the age of 5, right? Like I think I think we are just now coming to terms with, as a society, how important early care and education and supports are for families. And a lot of that starts in pregnancy. When someone decides to have a baby, they have to be supported and they need to be healthy. Those things really matter when it comes to obviously mom's outcomes, but also baby's outcomes. There is a ton of research that suggests that those health outcomes are really linked. And you can't help baby without helping mom. Like it's not possible. And so I think the research is really reaching a real precipice that we understand that this is a foundation. This is an important foundation for society. And the time is really right. Obviously, the pandemic has shown such a light on, children being out of school or moms trying to balance work, pregnancy, caring for kids. The time is absolutely right. And what we know is that the majority of brain development for babies happens under the age of 3, beginning in pregnancy and under the age of 3. It's important to get it right from the start because that can really address so many of the problems that we see down the line.
So talk to me a little bit about some of the greatest misconceptions about maternal health in the country, in the state, especially since you would think everybody would be for mom and apple pie. So why has there been this disconnect that needs to be addressed?
Yeah, I think taking a step back, the long and short of it is our moms were safer in childbirth than we are today.
Really?
Yes.
How
so
measured?
maternal mortality is on the rise. In 2019, we saw a 15% increase in maternal mortality in the United States. This lacks any comparison among similar countries. It makes, on paper, absolutely no sense. I think the next thing that is absolutely astonishing is that 60% of these deaths are determined to be preventable. That in fact, 60% of these deaths, there could have been some intervention that would have saved mom's life. And so that's a really huge problem, but you also need to dig deeper and note that maternal mortality is at an unacceptably high rate in the United States. It is significantly disproportionately impacting Black women and Indigenous women. So what we know is that Black women are 3 to 4 times more likely to die as a result of pregnancy-related complications.
I'm sorry, go ahead.
It doesn't make any sense, right? And so I have a colleague, Tasha Blaylock, who she said this, and I love this. If outcomes are possible for one group, they should be possible for all groups. There is nothing about being a woman of color that makes you more susceptible. There is nothing inherent about being a woman of color that makes you more susceptible to maternal mortality. It is the result of a complex web of structural and systemic racism that is putting Black women at risk. And it's just unacceptable. Like I said, if you are someone who cares about families start with a mom. They start with a birthing person. We have to care about this issue. This isn't just a health issue. It's really like, if you look at how you talk about maternal mortality globally, it's like a measure of your society, right? Like, and the United States is really in crisis. That's where we're at right now. And so I think that is problematic. I think the flip side of that is that the media attention is sensationalized in such a way that obscures the fact that there are a lot of things we can do to combat maternal mortality.
What's on your list?
It's on my list.
Yeah.
Great.
What are the
That's
things
a great
we should be
question.
doing?
So I want to be clear that this is a complex problem, and that I want to be clear that it is not a problem that you can solve with policy alone. Policy is really about creating the conditions necessary to address the problem. And the first thing I really want to talk about is this issue related to health coverage for folks. So nationally, about 40% of births, 43% of births are covered by Medicaid. Here in Pennsylvania, it's about a third.
Why?
So that a third of births.
Why?
Why? Because there's a lot of folks who need public insurance when they're pregnant. And so Medicaid is actually the largest single payer of maternity services in the country. And so if you want to move the needle on maternal health, it's a really good place to start with that type of policy. So what's problematic about the policy is that in the 1980s, Congress decided that if you use Medicaid as your health insurance during pregnancy, that your coverage will only last 60 days after your baby is born. There was no medical basis for this. It really was just members of Congress saying 60 days sounds good. We know now, medical experts know now, and the actual definition of the postpartum period is 12 months after the baby's born. And so one of the biggest things that we can do right now, yeah, isn't that wild, Maureen? It is the largest single payer of pregnancy-related services. There are states where it's like more than half of the births are covered by Medicaid. So one of the biggest challenges we have right now is that it's in Pennsylvania, about 10,000 moms a year lose their coverage 60 days after their baby's born.
Wow.
So they either need to reapply, go out and find new insurance, start paying for their own. Yes, that's possible, but any one of us who's had a baby knows that that's probably not going to be at the top of your list 60 days after your baby's been born.
Right.
And there are consequences. That means that people are not they don't have access to high quality healthcare throughout their entire postpartum period.
So has your efforts been to extend that automatically and get the coverage for it so that it doesn't have to be something that you think about the same way you don't think about feeding your child?
Yes. So if we go back, I was just going to say, if we go back to last year, there was this teeny tiny little provision in the American Rescue Plan that allowed states to choose to do this. It was always possible, but it was very cumbersome and complex, the only other pathway. So we have a new, more streamlined option available in the American Rescue Plan. And I very much want to commend the Wolf administration. This August, they announced that they plan to do that. I will say, I think the Thriving PA Advocacy certainly helped. So that's really exciting.
Congratulations for all of you.
Thank you. It's not a done deal yet. It's still, a little bit more complicated than that. So it's an absolute step in the right direction for Pennsylvania moms, but there's more work to be done.
When we talk a little bit about at the end about what we can all do to advance these efforts, make sure that we talk about what we can do at the state level as well as the federal level. Okay.
Absolutely.
There is a question that came in that I thought I would ask you.
Sure.
What is the leading cause of maternal mortality? Is it general pregnancy complications, or are there more details available?
That is a great question. I will be absolutely clear. I am not an OBGYN, so I can answer this from a policy perspective. And it's actually a really good conversation to start. There are different types of maternal mortality. So the umbrella term is pregnancy-associated death. That is a death that occurs within 12 months, either during pregnancy or up to 12 months after the baby is born. That's sort of the umbrella term. There is also pregnancy-related deaths, and those deaths are the direct result, or the pregnancy was the inciting factor of that death. There is a third category that is pregnancy associated but not related. That would be something like theoretically a car accident, right? I will tell you that it is not actually cut and dry. It is actually up to each state's maternal mortality review committee to use the information necessary to determine whether or not a death was pregnancy associated or pregnancy related. So there are sort of those medical events that, you might think of or know of. So a hemorrhage, heart conditions. There are a lot of things related to heart conditions that cause those sort of, I call them medical. I don't know if that's the right term, but that's what I call them. It's also really important to note that when we look at pregnancy-associated deaths in Pennsylvania, what is called accidental poisoning is the leading cause of pregnancy-associated death, and that's related to substance use.
Okay.
So it's broader than you think it is. I'll also point out that maternal mental health conditions are also a leading cause of death. So 1 in 7 women will experience perinatal depression. But when you expand that category and you look at substance use, you look at like postpartum psychosis, that nature, it is a leading cause of pregnancy-associated deaths. So obviously there are deaths that are related to, like I said, a heart condition or something of that nature, but it's really important for folks to understand that it is so much bigger than that. And it is so much more complicated than, oh, well, if you just go to the doctor and they check you, everything will be fine. It's a more tangled.
Not just
access to care. What we like to say, it's necessary, but insufficient. It will not solve everything, but it's the first step, right?
And it sounds like not just physical care, but mental health care as well. Are there members of the Thriving PA Coalition that are focused on that area as well?
Yeah, so that's actually, we have 3 stated goals. First is this postpartum extension piece. The next piece is related to increasing the number of screens for perinatal depression, and then also the follow-up, right? Because the screen, again, it's just the first step. And that is an extraordinary challenge. There's a ton of incredible data around the impact of untreated perinatal depression and also the actual cost. There was an extraordinary report out of Texas done by Mathematica that actually quantified the cost over the years. And it was astronomical, the cost to society of untreated perinatal depression. And so the very first step there, right, is making sure that it's being identified, and that not just identified, but that mom's actually getting into the appropriate care and treatment for her. I'll bring up the last objective that we have right now. It's related to doula support. So if you don't know what, sometimes I assume people know, a doula provides sort of consistent emotional, physical support before, during, and after labor. And there's a ton of evidence related to positive outcomes with doula support. The challenge right now is that Medicaid doesn't pay for it. And so some MCOs have programs where you can access a doula, but it's not across the board. And so it really is, once again, it's an equity issue that folks that can afford to pay a doula out of pocket have access to one. But folks who use public health insurance that don't have that sort of cash laying around can't afford one. So that's the third goal that we're working on. And there's been extraordinary progress in Pennsylvania. There's also been, I would say, the type of progress that would constitute leading practices nationally in Pennsylvania. So that's really exciting. And I definitely want to shout out the Jewish Healthcare Foundation for all of their work on that, leading some of the charge over there.
On all 3 of those.
They've helped with all 3, of course, but they're particularly taking the lead as it relates to what we needed to do was pull together a group of doulas to really begin this process of figuring out how. It's very technical, but in order to be reimbursed by Medicaid, do you need to be certified? Do you need to be licensed? All of these issues. And this has been happening across the country, and some states have gotten it really right, and some states have gotten it not so right. And so the wonderful thing that Pennsylvania has done has really had doulas lead the process from this point around making some recommendations, because what needs to happen is not just that we check the box that we have the policy. It needs to work. It needs to work for people, and it needs to work for the doulas themselves.
And you mentioned the cost to society was astronomical. I'm assuming this is a big lever when you're trying to get public funding or to change policies to support these 3 initiatives, right? So is there proof, or is there what are we leaning on? What can you tell me that will help me feel better that this policy will indeed get recognized, because, now you're going to relieve costs from a system by investing?
Yeah, it's really, I would just hope that everyone sees that this is an incredible problem and we need to fix it. Some people see things different ways. And so it is really important to acknowledge that there are costs, there are costs to the government. So something as simple as when a baby is born and they are covered by Medicaid health insurance, their coverage is automatically for 12 months. But what happens is at 12 months, the family is reassessed to still see if they're eligible, right? What that means, though, is that the government is doing the exact same process at 60 days for mom that they do at 12 months for baby. It's just literally a waste. It's just a waste of time and energy when it's the exact same process. I'll also note that something that is really common with folks who use Medicaid as their health insurance during pregnancy is that they are more likely than other populations to kind of bounce on and off of Medicaid. So the coverage may lapse, but they are more likely than others to come back on. And there's an incredible cost to that. I think the estimates are around disenrolling and re-enrolling someone. It costs the MCO itself like $600 just to do that. And so it's really not a good use of money when we have all of this evidence to suggest that keeping mom enrolled in continuous high quality coverage, it's good for her, it's good for her baby. It also keeps you connected during a critical time of health where problems can be addressed before they become crises, right? So if you think about something like perinatal depression, if you have access to care, you can start working on that right away. We don't want moms waiting until it becomes a crisis.
So it kind of fits in with the whole, I don't want to make it with the ACA, but the preventive care, invest in the preventive care to reduce the downstream costs. You talked a lot about, when we were talking before, about the holistic nature of care and the need for that in the perinatal arena.
Yeah.
So when people hear holistic, they think it sounds like a lot of soft stuff and a lot of expensive stuff and a lot of inequitable stuff. So how do you see the importance of it, and how do you define that holistic care?
Yeah. And so I think what we're learning now is that from a policy perspective, the way that our health system is designed, there are incredible gaps for folks navigating the system, particularly when it comes to pregnancy. And so because people who are low income or not insured usually arrive to pregnancy uninsured, or frequently arrive to pregnancy uninsured, and across the board, Americans are arriving to pregnancy sicker than ever. So that's worth noting. Yeah.
Why is that?
We don't have the best healthcare system or the healthiest habits as a country, I guess. Right. So like on aggregate, Americans are arriving to pregnancy with more sort of health complications than they were in the past. And so it's really important to think about what we can do with policy to make a constellation of supports so that moms don't fall through the cracks at any point, right? So you need your OBGYN, of course, or your midwife, but a doula can provide another type of support and service. Home visiting programs can provide a different type of support and service. We need to be thinking about all the different levers that we can pull with policy to make sure that moms are supported during and after, really before, during, and after pregnancy, because that's the best way for moms to have a healthy pregnancy, have a healthy baby, be able to focus on caring for their baby, and if they choose, get back to work and keep on moving forward. If folks aren't healthy, all of those things become significantly more challenging.
As you mentioned that in the next step of going back to work, and I know we were talking about childcare and the different policy things that are in the current administration's proposals of Build Back Better. What can we do? What kinds of things are you looking for help doing or support? What are the next steps? What's most important to move this forward?
So, like I mentioned, the Wolf administration has already announced its intention to sort of take up this option to extend postpartum Medicaid. It is not a done deal in that, it has to go into the budget, which needs to be approved by there's still steps in the process. We are incredibly fortunate that we are in this position, but there's still a little bit of a ways to go. There is another provision in the Build Back Better Act, which is currently being negotiated in Congress, that would allow for mandatory permanent postpartum Medicaid extension. And this is really key for two reasons. Number one, I had the good fortune of participating in a hearing by a federal commission that oversees Medicaid and CHIP on this issue. And the recommendation by this, body, this sort of, there's some heavy hitters in Medicaid and CHIP, was that Congress should extend postpartum coverage to 12 months. It should be mandatory. And they actually recommended that it was so important that the federal government should pay for 100% of the costs. That's, to my knowledge, that's never happened before.
Wow.
That's not in the bill, but the mandatory permanent part is in the bill. And so it's really important that we don't just sort of rest on the fact that, like, okay, Pennsylvania said they would do this, especially because that's not health equity, right? Like, that doesn't help moms in other states, and this is a national problem. And so we have the opportunity right now to really urge our federal legislators to protect this provision, keep it in the bill. It's very important. I know there's a lot that's very important in the bill, and so this is just one ask. But this would really be an extraordinary step forward for us as a country and not just as a state.
So to that end, are there other things that we should be looking at that might not be, the top of the list, but that we definitely should pay attention to, might be coming down the path, in the next few months or next year?
Yeah,
What should we have our antenna up on?
So I would say that this is definitely a key issue here in Pennsylvania, and there's a lot of things that we can do and that we should do. And so I can tell you that in the there's been a number of bills that have been introduced in the General Assembly looking to address certain issues. Unfortunately, due to the sort of environment in the General Assembly, these bills have not really moved at all. But there's some really great bills. One that I definitely want to call out is related to making maternal morbidity a reportable event. So currently, we know nationally for every maternal death, there is an estimate that 70 moms will experience a severe maternal morbidity, which is classified as a near miss. Right now in Pennsylvania, we don't have a centralized way to report that. And so we basically don't know what we don't know when it comes to morbidity. And okay, these are folks that will very likely need a higher level of access to care, either for an immediate period or for the rest of their lives. So that's just one example of of something that we're trying to do here in PA that, and I think it's a pretty straightforward lift, right? Like it's
you
about
would
changing
think you can make the case, right, for invest here and keep these people from becoming right.
And so that's just one example. And then, there's so many, there's another set of bills that would require implicit bias training for anyone working related for OBGYNs and anyone related to working sort of in the field of pregnancy. That is not, again, it is not a solution, but it is a step in the right direction because it's absolutely critical that we start to really piece apart this systemic and structural racism that's leading to poor outcomes for Black women and their babies. Again, there's no reason for it. There's absolutely no reason other than sort of these barriers that have been put in place and calcified over time, unfortunately.
Is there anything else you need to bring to the forefront as far as Thriving PA or the Maternity Care Coalition at this point?
I would encourage everybody to check out the Thriving PA website. thrivingpa.org. If you're someone who likes to visit your legislators, there are a number of fact sheets that you can bring with you. You can talk about how important this is to you, or if you want to talk about something else, you can leave those fact sheets or send them in an email. I don't even know how people are doing it these days. But I really encourage you also to just generally keep an eye. You can follow us on social media, Twitter, Facebook, all that good stuff. We're just getting started. And I think, you spent a little bit of time with me, Maria. I think you know that I'm not going to stop, even if we do get our 3 goals met.
I'm sure you're not.
Yeah. And so I really encourage everybody to check out that website and follow.
And I know your list is endless too. You had, here's my priorities, here's my next, here's my hopeful, here's my yes. So.
Yeah, it absolutely is. And I think, something that I shared earlier, but I think bears repeating is that this is a complex problem. And I want to be careful not to suggest that you can solve it with policy alone. But we need to, for folks on this call, for the coalition, we really need to make sure that people understand that something needs to be done. And a lot of those somethings can happen through policy change. They can at least start through policy change. And so it's really important maybe not to let legislators or, other folks off the hook and say, oh, well, we'll let the doctors fix it, or we'll let the home visitors fix it. There is no group alone that can solve this problem. It requires a coordinated approach. And one of those groups is legislators and policymakers.
Well, I appreciate that you bring us back to that, because of course, complex problems are what we try to deal with the Bucks County Women's Advocacy Coalition, and really recognizing the systemic changes that need to happen before we can have equity in our system and do better for all citizens, all Pennsylvanians. So we'll really appreciate you bringing it back to that. And I want everyone to know on this call that Build Back Better is a very important part of this immediate outreach that Sara and her organizations are looking to support. So it would be very helpful for you to contact your legislatures at the federal level, as well as keeping an eye on the state level, as she talked about earlier. And we've made it easy for you because thanks to Iffy, you will be receiving an email tomorrow with the recapping what you talked about here today, with some good calls to action that you can implement right there from the email. And we'd ask that you please share it with people who weren't able to be on this call, because that's the only way we're going to get our voices amplified, is by reaching out and joining with others, as the coalition tries to do with all of our members. So I wanted to make sure that you knew that's going to be made easier for you, but it still requires you, as always, to take action to help Sara and to help women across the state get a better start in life with their children. Is there anything else, Sara, that we missed or you want to emphasize before we wrap it up?
No, I'm just really excited to have the opportunity to talk with this coalition. I think this is an issue in particular that, everybody has a mother. Everybody has a mother figure. Many of us are moms. And it's really important, especially for folks coming from a position of privilege, to kind of pause and think about how that privilege has informed your own pregnancy, your own birth, the way that you're able to raise your children, and to be able to say that everybody should have that. There's no reason that everybody can't have that. And so when we think through these policy changes that put us in that direction, I think, especially if anybody who is in that world, caring about moms, caring about gender equity, caring about families, if we band together on these issues, we can certainly make a big dent.
And I love the way you keep it framed as this is for families, and that's really what it's for. And I think you make such a great point. And I want to really thank you, Sara, for gifting us with your time and your talents, and even more so, not just for today, but for everything you do on this issue and similar issues, because you're a fabulous breath of fresh air and light on this. And I appreciate you sharing your information with all of us.
So thank you. It's a team effort. It's a team effort. I have great partners, but thank you very much, Maria.
Well, you're a pretty good team player, I'll have to say, just based on our interactions so far. And I just want to also thank the board of directors of the Bucks County Women's Advocacy Coalition and the issue specialists who volunteer their time to follow the issues closely and to track legislation, which is an endless, sometimes thankless, but always important job. And we look forward to doing this again next month. So please save the date on your calendar. We'll be back together again for Keeping It Brief on Wednesday, November 3rd at 1:30 again, 45 minutes, take that break in the middle of the day to learn about something that's of so much importance to not only ourselves, but our society, and how we can all work together to amplify our voices and make a difference. So thank you all very much for joining us today.